I want to talk about supplemental feeding methods, bottles, and pacifiers. When you hear the term supplementing, the term can be referring to supplementing with breast milk or formula. It's just a term used for breastfed babies. There are several techniques: cup feeding, syringe feeding, finger feeding, supplemental nursing system, and bottle feeding. I'm going to show you the supplies and talk more about these techniques in another video. A lot of parents are concerned about bottle feeding and how it'll affect breastfeeding. I've had a lot of experience helping preterm babies who've mostly bottle fed early on end up breastfeeding almost exclusively once they get older and stronger. Although there can be some slight nipple confusion, most of the time the issue with babies no longer breastfeeding after taking a bottle is related to the flow rate. And it makes total sense if you think about it. Listen to this real-life example. A mother is breastfeeding her baby who's 36 hours old. He's been breastfeeding well but is starting to cluster feed and his mom is exhausted. He's feeding as frequently as every hour. Mom is concerned he isn't getting enough at the breast. Her nurse and lactation consultant assure her he's doing exactly what we'd expect him to do. Cluster feeding, it's normal, and there's an end in sight. They educate her on expected output and signs and symptoms of dehydration in babies. They also show her how to hand express and remove colostrum so she feels confident he's getting colostrum from her when he feeds. Her baby continues to cluster feed, and she gets anxious and asks for a bottle of formula. She isn't educated on PACE bottle feeding. She gives her baby a bottle of 2 ounces of formula in less than 5 minutes. She continues this throughout the night. The next day, she's tearful and upset because she can't get her baby to latch. The lactation consultant sees her and explains the flow rate of the formula out of the bottle is faster than the flow rate of the colostrum out of her breast. In this example, the flow rate of the bottle feeding caused the latch issue. It wasn't just the formula or the bottle. PACE bottle feeding is imperative to know when you're breastfeeding and bottle feeding. The flow rate matters a lot. Your baby is going to get frustrated at the breast if he's getting a fast flow of milk from a bottle. I've talked about PACE bottle feeding before. It's really important to pace your baby when you're giving a bottle. It helps your baby to be able to go back and forth between breastfeeding and bottle feeding. My Instagram TV channel has a real-life video of me showing you how to do a PACE bottle feed. There's also tons of videos on YouTube. And remember PACE bottle feeding if your baby needs to be supplemented. Pacifiers. Is it okay to use a pacifier? The answer to this can be really confusing. The American Academy of Pediatrics recommends using a pacifier to promote safe sleep, but the World Health Organization's 10 steps to successful breastfeeding says not to give any pacifiers or artificial nipples to breastfeeding infants. So which is it? I recommend waiting to introduce a Paci after breastfeeding is established. That's usually after the first 2 weeks, when mom's milk is in and your baby's latching without any issues. Why? Because if your baby is sucking on a Paci when he's hungry, it can affect your supply. I've walked into many hospital rooms where parents have given their newborn a Paci because they're trying to make it to the 3-hour scheduled feed. We talked about feeding on cue earlier. Do you see why this is an issue? If your baby isn't allowed to cluster feed and your baby is going to town on a Paci instead of cluster feeding, your body's not getting the message. This can really affect your supply. If your baby is latching well and your milk is starting to transition and come in, and you feel confident in your ability to read your baby's cues and want to use a Paci, it isn't going to mess up breastfeeding. Just make sure you're not using the Paci to hold your baby off for feedings, except those times you might really need to. A good rule of thumb is this: if your baby sucks on the Paci and falls asleep within a few minutes, he probably wasn't hungry. He just needed to suck on the Paci to help soothe. If he's sucking vigorously on the Paci and is irritable and alert, he's probably hungry.